What are some of the challenges that your students face?
The biggest challenges for my students in the classroom would most likely be focusing on the task that is at hand. For the most part, they find different things that they stimulate on. A lot of children in my class self-stimulate. They have hand flapping, making noises, are distracted by what is happening.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
And other places in the room, it's, as I said, it's a broad spectrum, so there's many different things that can cause them to go off course. Also internal stimulation, things that are going on inside their mind that we might not be aware of, that we try to bring them out of that and get them more focused on what we're trying to express to them, a lesson that we might be able to teach them, not necessarily academic, but a lot of times social skills that they need to develop so they can function better within the classroom and within society as general.
What have you learned by experience in the classroom?
There's definitely a learning curve for teachers, especially new teachers, when they step into a special needs classroom. You will be given circumstances that you never would dream of, even when you are.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
Reading case studies if you're, in the midst of still getting your special needs, special education credential. What I think is the best thing to do when you're in that classroom is to just be open to your own instincts, to be able to step aside and realize that it's not about you, it's about that child. What does that child need? Your day might not be going the way that you think it should be. That child may not be behaving exactly in the way that you would expect them to behave or would wish them to behave. But just taking your cues off what that child's giving you, but at the same time, just instinctually, I say, setting up those boundaries and using techniques that you're learning in your special ed courses. And just, again, taking those things that you inherently would feel would be helping that child and not escalating into behaviors is a good first key. Now, there's a lot of other things that you can be doing at the same time, such as techniques with behavioral modification, which are going to basically structure more of the child's day and what's going on with, behaviors that you find to be a hindrance, and replacing them with things that will be more not only socially acceptable, but if they're doing self-interest behaviors, will help them to be physically safe.
What drives you to continue to work with special needs children?
What pulls me to continue teaching these children and working with the families, because I find that to be more of it's a unit. You have the child, you also have the parents. It's just part of, because everything needs to be generalized. What I'm doing in the classroom needs to be followed through at home. I try to keep that going as best I can. Some parents step up to it a little bit more, some don't. The parents that do end up finding that the progress of the child increases if there is that reciprocity with what is at home and what is at school. And just watching the children grow.
Kids with ADHD or autism want to be independent. Try Goalie, the visual scheduler that guides them through routines so you don't have to. Goalie, reinventing routines.
And change, and watching their personalities become more defined, finding out what their likes and dislikes are, what's working for them and what's working for the family. There's a lot of times, depending on the severity of the child, incremental growth can be very small. And general education teachers sometimes don't see the growth that these children have. But I see that, and I know that the parents see that. And just something that can be as small as the child making eye contact when they haven't in like 2 years, that is a really big achievement in being able to know that that child is trying to communicate with you, express themselves in a way that you weren't used to and were hoping that they would. That's what keeps me going. I just like watching the change. It's remarkable because they all have the potential. They all have the potential for great things. But again, knowing what those great things are on a level that's commensurate with what their abilities are.
Do you use any type of reward system in the classroom to help motivate the kids?
In the realm of trying to get children motivated to do their work or to participate in an event that you may be doing in the classroom, we do a monetary reward system. So a lot of children are going to respond in one way and a lot in another way. So again, it's distincting out what works best for them. I have some children that really love stickers. So I'll give them a series of stickers, and usually that leads up to a bigger reward. So say if you will play on the carpet with your friend for 5 minutes and be able to do that without hitting them, that can be a sticker. If they get like something like 4 stickers within like a certain amount of time, if they really love the computer, then that is basically a gateway for them to earn enough stickers so they can get that larger reward. So they know that there is a light at the end of the tunnel. So they feel really proud in being able to attain those stickers for a larger prize. Again, sometimes that might not work for some kids. Just even a pat on the back or great job, they really respond to, or a smiley face on their paper, or time with a friend. So just depends on what they're looking for, what it is that their needs are that is going to motivate them to achieve.
How do you address hygiene amongst the kids?
One of the big things that I note with special needs children is the propensity for them to be dirty. They like to get into things, which is great because they're exploring their environment, and that you're going to find with within the general education population as well. Kids, it's all new experience. They love to get in the dirt. They love to play in the water. They love to run around. They get sweaty. They eat foods that they shouldn't be eating. So along those lines, it's tough as heck to get any kid to brush their teeth, to take a bath.
For families living with ADHD or autism, preventing meltdowns is everything. Goalie reduces stress by enabling kids to complete routines independently. Goalie, reinventing routines.
To wear different clothes. But then when you're dealing with a special needs child, especially a child with autism, and they do like that routine that you have going on, it's important to establish hygiene as a routine within their day. Within my classroom, we wash our hands all the time. They do get into stuff. If I see that they're touching the floor or they're playing with something that's making them dirty, the first thing they know is that Mr. Duce is going to tell them to go and wash their hands. As well at home, make it a ritual. It's bath time. I know, kicking and screaming, you'll do that with any kid. They don't want to get clean. But do the best that you can. Make a game out of it. Find something that's going to be a hook for that child to get clean, their body cleaned, clean their fingernails. I know that can be very painful to some children, especially children with special needs. Find different ways that you can do things to clean their nails, to brush their teeth, which is a big problem as well. As we all know, we hate brushing our teeth. We always I forgot to do it last night, I'll do it in the morning. Again, trying to set up a routine. If it's not something that they're particularly fond of due to sensory issues, and try to find a way to make it a game. Do anything that you can to get them into the habit and try to make it fun for them.